Hi. Hi, Dr.
Hey,
Steinbrech.
how are you
How are
doing?
you? I'm good.
I'm
How are
doing
you?
great. Yeah, thanks for having me.
No,
It's stormy.
thanks.
I'm doing great. It's actually pouring rain in New York right now.
Oh,
So
so you're
it's
in New York right now.
yeah, yeah, yeah.
Okay, nice. Well, thank you for accepting the invitation to join me.
Absolutely. Happy to be here.
Yeah, it's a pleasure. So I'd like to start asking about how's COVID impacting the cosmetic practices around the city there in New York. It's been hit pretty hard, the city itself, so
Yeah,
probably there are some impacts, right?
we've been shut down for about 4 weeks, 4 or 5 weeks. My last case was about 5 weeks ago on a Monday. And then 2 weeks before that for the LA practice. Beverly Hills been shut down even before New York was. So Beverly Hills was shut down about 6 weeks ago. And we're both waiting to get up and going. We've been talking about it. We've been having a lot of Zoom, as you can
I'm
imagine, a
sure,
lot of Zoom
yeah.
planning sessions, both with my office, also with the California practice, and a lot of the doctors in the LA area and a lot of the doctors in the New York area. And so we're all itching to get back. I suspect in New York, they've bumped back opening up until uh, theoretically the 15th of May. We'll see if we'll be able to do that. We may be able to do some smaller cases. More likely, we're definitely focusing on late May or June. Same thing for Los Angeles, maybe a little bit later. We'll probably focus on June for there.
So probably 1 month ahead, still
Yep. Yeah.
isolated. So I thought it was really interesting that I think I read it about New York. I don't know if other cities are like that, but people that have their own surgical facility inside the office, are offering like the ventilators and all for the public service and everything. I think that was awesome.
Yeah, yeah, and we offered ours as well. It turned out just right when the need came. It was two Saturdays ago. Charlie Thorne up at Lenox Hill, and also the governor said, "Hey, we're going to need your ventilators." And I even got a tracking device for my ventilator because for our anesthesia machine, because we knew it was going to be shipped off to Detroit or shipped off to Texas after we got finished with it. And I just at least wanted to keep track of where it was going to be. So I got an Amazon tracking device and
Oh,
popped on that baby. Then things really changed just over that weekend from Friday, where people were freaking out, to Sunday, where they were about ready to send out the National Guard to the offices to pick them up. Then the deaths started dropping, and it looked like we were turning the corner. And so they let us, at least for now, hold on to our ventilators.
okay.
We're definitely they're registered with the state. So if we need it again, if there's something else that is going to pop up, that we'll be able to donate it.
Okay. Is it working at all? Like any kind of injectables procedures at office? Is the office open or
We're pretty
not at
much
all?
closed. Yeah, I'm the only one here. Everyone else is gone. They've all been working from home, and so nothing. Not I think that maybe I've seen one or two patients here, but no elective things, no injectables. Just really to see a quick post-op. We've been doing all virtual surgeries or virtual post-op visits rather, and we've been doing virtual consults. So we're keeping the practice moving. We're very much open online, but we want to keep that feeling. We want to keep, I've seen some practices. They said we're closing the door. It's
Yeah.
over. It's like this, and when they'll say,
Yeah.
"We'll see you when we're open. Good luck," and that's it. We don't want to be that way. We want to be open. We want to be very accessible. We want you to know that we're working every day for our patients, for our practice, for our post-op patients, for patients that are interested in procedures, and also for patients that are interested in learning more about it, because we are, we're dynamic, and I can't go home and and climb underneath my bed. I have to be working. We're also working
That's
on
true.
a lot of finishing up the textbook, finishing up writing a lot of chapters for new for new textbooks that my friends are putting together. So and working on some branding, new content, answering a lot of patient questions, a lot of before and after photos. So it's a good time to really expand on the men's side of it.
That's something I wanted to ask you about. You're very business oriented. So do you have any kind of background on that? Did you have any training? Zero. Okay, that's interesting. Yeah.
Nothing, but
Born
I've always been interested
born
in
an
it.
entrepreneur.
Yeah, basically, I grew up in a small town in Iowa, and it was a farming community, very agrarian. And we were taught that, you know, not many kids out of my town went to college. I was the first kid to graduate from college from my extended family, and
Hmm.
then first kid to nobody from my town. Maybe I think another kid from my high school went to medical school before I did, but it just didn't happen a lot. And if you did go to college, you sort of the mindset was really to have a job that wasn't only about industry or only about business or only about money, which was too bad because I think business is so interesting, and I don't think it's evil to like bankers have been some of my best friends. Bankers helped me start my practice. Bankers helped me buy my implant company or my medical device company. Bankers have made my dreams come true. So the idea that business people or those kind of professions are somehow less than is not exactly true. You really kind of have to do what you want to do. And if you're, I know a lot of doctors out there, but if your doctors wanted their children want to do something else, you know, they want to be a lawyer, they want to be a banker or a business person. I mean, these are the people at the banks right now are keeping our country together. You know, along with the people on the front lines, the nurses and the doctors that are taking care of the patients. The people, the backbone are the banks and the people that are keeping all of us afloat. So it's not a bad thing.
That's interesting. Yeah, that's really nice. Well, talking about like business minded, being business minded and
Yeah.
everything, like you probably found a niche that is male aesthetics and male
Yeah,
plastic
that I
surgery and
mean
procedures, right?
that's part of what it is. I really found I found an area that I thought was hugely underperformed and underrated, undertaught, undereducated, and I felt and under utilized. And I felt that it was a shame, and it was a huge opportunity, both in terms of patients that could have these procedures done that they never realized could be done, and also for surgeons to open up and have this exciting new wealth of opportunities. But when I say wealth, I mean opportunities in terms of techniques that they could help these
Mm,
patients. For so many years, we've told our male patients, well, we as physicians and we as a plastic surgery community haven't taught any of the residents how to do any of these cases. So what we did is we told the men, listen, you don't need it. And what that means translation is nobody ever taught me how to do the procedure.
yeah, I
Or
remember.
they said go, no, you don't need to that, go to the gym. Translation, nobody ever taught me how to do this procedure. So and we created a boogeyman. A lot of it is the ego of the plastic surgeons, and most of them are men, and men are to blame. Hi to all the women plastic surgeons out there, because I'm so happy, and women patients if you're watching, I'm so happy to have more women in medicine and training in plastic surgery in general. It's huge. I welcome you all, and I think it's amazing because they really are creative, and they really are good doctors, and they really are compassionate and very caring physicians. And technically, they're good, and they have an eye for style. So I'm glad to have so many women becoming plastic surgeons. But for a long time, it's been men, and men had the blinders on, and all the guys in aesthetic surgery wanted to be the king of the faces, king of the breast augmentation, the king of the tummy tucks, and they left the men behind. And they never learned how to do any of the men's techniques. and they didn't want to be known as being a men's plastic surgeon because somehow that was less than being the king of the women's plastic surgery. And they were arrogant, and they didn't realize that there was probably a business and that there was probably a demand for it because nobody ever did it. Nobody ever taught the residents how to do it. And it's all because of all those things, they created a boogeyman. And the boogeyman was the male patient. The male patient is difficult. The male patient is demanding. The male patient will never be satisfied. The male patient could be able to do this at the gym and really doesn't need this. And all of these things are completely wrong. They're
Yes.
complete myth. There are good men patients. There are good women patients. There are difficult, challenging men patients whom we love. There are difficult, challenging women patients whom we love. People are people. So the whole
Exactly.
idea that women are good patients and men are bad patients, that was just all made up to give surgeons the permission not to deal with men, the permission with their staffs to protect their egos so they could admit to the patient, so they didn't have to admit to their staff, maybe they need to practice doing men, or maybe they need to be trained on doing men, rather than admitting that they never would and they're not good enough and they really don't know how to do these procedures on men. It's tough.
That's true.
Surgeons have egos. It's hard to admit to patients that they don't know how to do a procedure. It's hard to admit to their staff that the procedure didn't go well because they haven't done enough of these or they never got the training to do that. So the better way to do it is to say that that guy was crazy that we just saw. He didn't need to do it. He should go to the gym and he should just go back to his job and stop feeling so needy.
That's interesting. Yeah, I
Yeah,
remember from even my residency. Sometimes I would come up to my attendings to discuss some case I would like to book or something. And if it was a male patient, they would be like, "Why don't we choose something else and try to find a woman for us to do the case together or something like that?" So it's very
absolutely.
true what you said, and that's
Absolutely.
nowadays.
I
And
had a
it's
couple
com
of patients. The residents would come up to my office, learn some of my techniques, 270 torso tuck, 360 torso tuck, a total torso transformation, body banking, moving cells to the chest, to the shoulders, to the traps, to the biceps. And then they would go back to NYU, book a case to do it as a residency case, and it would get canceled by the attending because the attending
yeah.
would say, this patient doesn't need this. Patient doesn't, because the attending didn't want to take responsibility because it wasn't really sure how to do the techniques
Yeah.
or to follow up with it. So it's
Wh-
sad.
which is which is sad, and it's opposite to what we see in our private practice nowadays. Like the male patients are just growing right now,
Absolutely.
right? So it's
Absolutely.
sad that people don't get enough training with male patients. Yeah,
I think they'll get a lot more. I'm one of the traveling professors for the ASAPS, or the Aesthetic Society, as we're now known, and I'm getting a lot of requests to run around the United States and go to these university programs. So I think I think they're starting to identify that the residents need to be taught, and I think there's also a demand the residents are requesting to have some more information about how to deal with male patients and how to operate on them. So I think what's going to change a little bit.
that's good. Someone just asked a question about the main differences in between a male and a female facelift. If you could like give a short explanation for that,
Sure.
is that okay?
Yeah, absolutely. First, you want to do is you want to you want to talk about the style differences, which means um, what men can and can't do. Generally, women wear makeup, more makeup than men do. Some men are doing it. Guys in Korea wear makeup in other places, but generally men don't. Men have a different hairline than women do. Men tend, and all these are generalizations. I'm trying very carefully not to be sexist, but you do have to make some type of generalizations. Otherwise, we can't even have a conversation. Men tend to want to be not. They would rather look more natural, and they'd rather let a little bit go rather than pull everything high and tight and have it be more surgical looking or more feminized. So that's the basis behind it. So for men, what I'm more likely to do is not stand on the end of the table and pull up high. I'm more likely, and I always tell the men, for the men, my target is like the guy in the Marlboro Man who looks sexy. He's got a couple lines, which is cool. That's sexy. We like that. We don't have to get rid of everything, but we just don't want to look overly old. Or the brawny guy, the big guy on the paper towels, where he looks kind of rugged. You know, that's sort of what we're aiming for, not feminized and not surgerized. So for the men, what we're likely to do is to make shorter incisions. We do not want to alter the hairline, so we want to make sure we keep the hairline down for the men. I'm less likely to I'm more likely to make a pre-tragal incision rather than a post-tragal incision, unless the patient has very cannot grow hair. There's some guys that can't grow hair and a beard. For those guys, I'll extend it all the way to the tragus. But if a guy has a big, thick beard, we'll usually go pre-tragal for that incision. And also for men, we can do a Z-plasty for the neck and get away with that, whereas for the women, we're less likely to do that or be able to do that. But in general, just less with everything for men. For men, I'll leave a little bit more of a fold for the upper eyelid. Just keep in mind there's the crease and then there's a fold. For men, I'm less likely to pull too much on the brow. I relax the brow. I give them a little bit more of a fold, and it's all about looking natural. There's also a gradient. In New York, people want to be even more natural because they're closer together. They're in tight quarters. They're at bars in the restaurants, and the tables are very close together. They're in tight boardrooms because there's not a lot of space in New York. Out in California, it's a little different.
Here's your reminder.
Because, sorry about that.
Take my pills.
Yeah, take my pills. I'm on antibiotics. I'm on antibiotics because I had appendicitis on Monday. Here it comes.
Reminder.
Did you go under surgery?
They didn't. My appendix was considered non-essential. So I'll tell you this quick story because it's funny. Monday night, I think I'm the cook in the family. So I get home and I say, "Hey, everybody, the cook's home." That's it. I don't do any dishes. I don't do anything, but I like cooking because cooking is something that a surgeon does. I got one thing I want. I rebuilt my house out in the Hamptons, and I wanted to have a big mother kitchen. I wanted to have a big kitchen, because I wanted to cook. It's something I always want to do. And cooking is fun because it's like a surgeon because you have to be efficient. There's several steps. You have to know what the next step is. You also have to be really efficient with all the crockery and the cooking and all the utensils. You don't want to get everything. You don't want to make a huge mess. And there's a time element. So and also there's a little bit of style, and it's about the presentation, make something beautiful. And at the end of it, you have 10 people that come over for dinner, and they're like, "God damn it, you're a surgeon and you know how to cook and you can make this?" Like, that is really amazing. And we as surgeons, aesthetic plastic surgeons, we want to be creative. We have a creative mind and we want to impress people with our results, So I find like cooking is a really cool new hobby of mine, and I really enjoy it. No, I don't do any dishes. I don't do any of that. But so I went home on Monday night. I did some cooking. I thought, I ate a little too much, and I was just like, I'll just go to bed and it'll go away. So 1 o'clock in the morning, and I go to bed at 10. 1 o'clock in the morning, I couldn't go to sleep 2. And finally 3 o'clock, I said, I've got appendicitis. I knew, how you just know?
I don't know. I never had it. But I can imagine.
But you know the diagnosis.
Yeah, of course.
I've taken it. I've taken 300 out during my general surgery time before plastic surgery. And so I said, this is not going away. And I went to NYU. I got a CAT scan. I did have appendicitis, but I didn't have fevers. I didn't have an elevated white count. Thank God there was nobody else in the ER. All the COVID stuff is over in the ERs. But they said it's inflammation, is really appendicitis. But right now, with all COVID going on, your appendix is non-essential, and we're going to put you on antibiotics and let it cool off. It was like a gallbladder kind of thing. So I just missed my dose of Flagyl, so I'll take it after we, after
Okay,
we end it.
you can take it now if you
No,
like. I
that's
don't think.
okay. That's okay.
Okay.
So those are the difference for facelift for a man, basically. There's my
Okay.
answer.
Interesting.
Yeah.
Um, Another thing that I think is interesting is that you always talk about the kind of patients that go inside the office, like the one that want the male model look, or the one that want the I think it's that athletic dad look or something. Is that it?
Yeah. Yeah. So
And
we have a couple. We have 5 different iconotypes. So the first one you can just see us on our website, Male Plastic Surgery New York or Male Plastic Surgery LA. And women, and this is another generalization. Women are very different, and there's a spectrum. Women, I find, do not like to be pigeonholed. They don't want to be known as a worker, a professional, a mom, because women cross over so much. Men are stupid, right? We we don't care. We just want to be put us in buckets because you put us in buckets, and then we can talk the same vernacular. So if you walk in and say, "Look, doc, I'm not going to mess around. I don't care. I'm a businessman. You talk to me like a businessman. I'm a businessman." Another guy comes in. He's a model or he's an actor. Very different than a businessman. I'm going to talk to them very differently. So for men, I put them in buckets, and the first one is the male model or the actor. The next one is the bodybuilder, completely different kind of mindset, what his goals are. The third one is the daddy do-over. So that's the guy who sort of finished up, used to go to the gym, but now he's got a wife and a family, and so he's and a career, and so he's been working on that, and he's let his body go. So that's a third type. Then the fourth type is an older gentleman. That's the CEO. That's our C-level surgery, which is a CEO, COO, CCO, CIO. Those are all, or the chairman of the board. Those are older business people. They want neck lifts and eye lifts to stay competitive in their boardroom. And the last iconotype we have is Biggest Loser, which is the guy who lost all that weight, who has extra skin. And that's where we do our 360. That's our biggest movement that we're going into is the most that we do in the practice are the male model makeovers, which are the injectables, and the torso tucks, which are the 270, 360 torso tucks for a massive weight loss. And then our third component are the daddy do-overs, which are the body banging, taking all the bad fat and putting it up into the good areas for the rest of your life to create a total torso transformation.
yeah, that's excellent. Thank you.
Yeah.
Another question I would like to ask you about is injectables. Here in Brazil, mostly doctors are doing it because it's a different kind of professions. Nursing here, the nurses are not they're not trained for
Right.
injecting that kind of product. And I know there in the US, a lot of nurse practitioners do that, right? I'd
Uh,
like
yeah.
I do know you do a lot of injectables, so you probably do enjoy doing them, right? I think it's
I love
something
doing it. I love
that,
doing it. And even if I get old, and I mean, I'm already old, but
you're not.
when I get to, when I move into, I mean, I'm going to operate as long as I can. I told the staff, they know I'm going to operate for another 24 years. So that we're looking at 85, somewhere around there. But, but, even around there, if I don't operate as much, I'd still like to do injectables because injectables to me, it's like sculpting, and it's really like it's so relaxing, it's so artistic. Obviously there's a technical side to it, but it's when I do it, I do some injecting just like you do, Adrian. I do some injecting. I sit back and I look at it, and I look up and down. I have the patient turn. I take a second, and then I go back and do a little bit. It's a lot like painting, or it's a lot like sculpting. And to me, in that respect, is sort of relaxing, and it's enjoyable. And in 15 minutes to give a transformation to a kid or an older guy that they can't believe that just a little tweak here. We always say in plastic surgeon, in plastic surgery, everything we do, it's about millimeters. So millimeter this, millimeter back with the buccal fat resection, and a millimeter out here with the cheekbone or the jawline. You can make huge differences for people, and for younger or for older. And I enjoyed it in the young kids because it's sort of a great equalizer. You know, some kids, they weren't born with the beautiful genetics that you have.
Thank
So
you.
it helps them out.
It's all
But then,
plastic surgery.
yeah, right. But then also, there's some older guys that, you know, that they're, you know, not everybody can look like the Wolf of Wall Street, and not everybody can looks like, you know, George Clooney or Leo DiCaprio. So this helps them in the boardroom to have a more confident chin, a more confident jawline, a higher cheekbone that can not only have them do better deals. Let's face it, I tell the guys in the boardroom that everybody wants to be around attractive, confident leaders, and not just the people that are across the table that are doing the deals, but the team underneath them. They know that if they look confident, if they look tight, they know if they look put together. They know that the people underneath them want to work for that team leader. They want to work for that confident guy, that guy who looks like $1,000,000, and they tell me that, and they know that. And it's also for personal reasons too.
Yeah, that's very interesting. We have different kinds of probably because of the FDA, we have different kinds of fillers that we use here in Brazil and there in the US. What kind of brand do you use mostly for fillers there?
Um, I use mostly products from our good friends over at Allergan.
Okay.
So we do use Voluma. We use I do use a little bit of well, Voluma is what we use for most of it. And then we do neurotoxins. So we have either Xeomin or Dysport or Botox, or Newtox. Motizetti, hello to you, my friend,
Nice.
and all of our friends over at Allergan as well. I like all those guys. I work a lot with the industry. A lot of the people in the industry are friends, and they're great leadership over at Allergan.
Do
Brent,
they have Volux there already?
what's that? And
Vol,
Carrie, I
Vol
wanted to give a shout out to the Allergan
Yeah, for
people.
sure.
Carrie and Brent and all you guys over there, and also the New Talks people. So hey, Modi. What were you saying?
There's a new product, Volux by Allergan. Do you have it in the US or not?
Volux.
Volux, yeah.
Yeah, we haven't used it yet.
Oh, yeah. Yeah, well, I haven't seen it yet. I just read something about it, but
Need to get on it. Need to get on it.
yeah. So, do you have a certain age that you start recommending Botox treatment or Newtox or any
Yeah.
botulinum toxin?
Yeah, usually people like in their mid-20s to early 30s. And it's not that we want everybody to look just frozen. I can still move things. You can see that. But what we don't want is we don't want deep creases to start to form. And everybody knows that, you know, and a lot of times men say, "Oh, that's fine. I'm fine with that." Yeah, you may be fine with that right now, but it's sort of like we all know it's preventative medicine. So it's good to have a little line here when you animate, but you don't want to have deep creases that become permanent because everyone focuses on trying to make this look young. And then in their 50s, you have really two different things happening. And so we want to keep that harmony going through. So Botox will start to do late 20s, early 30s. We have what we call actors Botox for people that we focus on centrally because we want them to make sure that they can use their brows for expression on the
That's
stage,
interesting, yeah.
or so we call it actors Botox, and it also gets people starting to use it. My philosophy, and this is a good point for a lot of the younger people in the office. I always tell my patients, if I'm not in this room injecting you, I'm next door injecting someone else. So people trust me that I'm never going to put too much in one person, and I don't want to. So I always want people to come back and want more. That being said, I tell them that some of the product that we put in is going to produce some swelling. You probably want to come back. You probably want to have a little bit more. I never say touch up. Touch up is a bad word in our office. We don't say touch up. We never say touch up, and we never say fix, because those things, we say more product. You may require more product. Whenever we say touch up or fix, that usually implies that the doctor did something wrong.
Yeah, exactly.
or,
Yeah.
or something needs to be fixed. Usually what it means is when patients come back, what I don't want to do is the first time I meet them, of course, or ever, I don't want to put in too much at one time where they feel overfilled or they get nervous for a couple of days waiting for the swelling to go down. I'd rather have them be at a partial correction, because two things happen. They get to see where the full correction, because of the swelling, where the full correction will be ultimately. But also it prevents, particularly people who are coming in for the first time, who are virgins, it prevents them from freaking out after the swelling starts when they walk out of the office. Because they had too much. So people like that. I learn, I sort of twist it around. I tell them I want to learn more about your face, which is true, but I want to learn psychologically how you react to things. So I don't want you to freak out when you walk out of my office. So I want to learn how your face and your brain works. And I want you to learn about me and gain my trust. So that's why I don't puff people up. And also, I don't want to puff people up and then zing them with some big, ridiculous bill or something like that. That's not my style.
I have one final question from me actually. How does it work, like the dynamics? Since if it's a patient that's walking in the office just for injectables, does he pay for a consultation fee and then they go see you and then you say whatever?
That's a great question. They run through. First of all, I have a male consultant, patient consultant. So they go through Joseph, who does the work of 4 other consults, because we had 4 consults before, and he's really amazing. And if people are afraid of, when I first started, I was afraid of having a men's, and particularly even for women who have to undress. But the women don't mind. The women don't care that you bring them their coffee. They just care that they get good information, men and women, and that that you answer all their questions and you follow up with your emails, and that's the most, and that there are no mistakes or no hiccups. So that can be a man or a woman. So you shouldn't necessarily think that you have to have a touchy-feely woman consultant, practice consultant. No, that's not that. Women are smarter than that. Men are smarter than that. I don't care how touchy-feely.
Yeah.
I don't care how touchy-feely. They want correct answers. So he sees all of them for the injectables as well, and he figures out what the plan is, and then I review the plan with them, and then we charge them a consultation fee, because the time for the office is extraordinarily expensive just to see consultations. So we have to do that. It also makes patients really to commit to come in, so they don't ghost us. So it's about commitment. It's not about the money. It's about commitment. And then once they do it, we apply like most offices, we apply that toward whatever procedure they're having, so it's fair.
Is it all the same? Usually the patient get the procedure on the same day, right? Or not?
Usually, yeah. Usually for injectables they do, because a lot of times they're flying in from Singapore, or they're flying in from Europe, and they want to go right back to JFK. So a lot of times they're just flying in and getting the injectables and going back home. Occasionally they want to get the consultation, but they have a wedding that weekend, in which case we bump it to another day.
Okay, that's perfect. So I think we are running out of time already. There are some questions here. I don't know if you can like reply here, or you can like write them through DM. I don't know what's better.
Yeah,
you. What's best?
you can go ahead and DM me at Male Plastic Surgery. My Instagram is Male Plastic Surgery, so you can just DM me there, and we'll get you some information. You can also follow me personally on my personal site, which is Dr. Steinbrech. And that's more about me traveling around, talking, and my family. It's not as much about men's plastic surgery. So you can also see me there. And you
Okay.
at Dr. Steinbrech, I'll answer those directly.
Perfect. I'll do that. Well, thanks again,
Thanks
and
for having
take
me.
care.
All right.
Thanks.
Be safe.
Bye. You
Bye-bye.
too.